want to bring you an update in the meantime on a story we're following overseas. Britain's Prime Minister is in intensive care this morning after his fight with the coronavirus took a troubling turn. Boris Johnson, a key U.S. ally, was moved to the ICU last evening. He was taken to the hospital initially on Sunday after persistent fever more than a week after testing positive. Elizabeth Palmer reports from London.
Britain's Prime Minister spent the night in intensive care getting oxygen, but Downing Street says he's not on a ventilator. Late last week, Boris Johnson emerged briefly from his residence to applaud health workers, but in a Twitter video admitted he wasn't well enough yet to end his isolation.
Alas, I still have one of the symptoms, a minor symptom of I still have a temperature.
That was clearly an understatement. 48 hours later, Johnson was in the hospital. Early in the outbreak, he fronted the UK campaign to promote hand washing, but also boasted about shaking hands with coronavirus patients, which suggests multiple exposures. Johnson works to stay fit. He's a keen cyclist and tennis player, but he's also 55 years old and male, which elevates his risk of complications from coronavirus. His pregnant partner, Carrie Simons, had coronavirus symptoms too, but she's recovering. Boris Johnson has handed over the running of the UK government to Dominic Raab, who's the Foreign Secretary, as Britain passes another grim milestone in this pandemic. More than 5,000 people have now died here, although there is some evidence that the spread of the infection may peak this coming week. Anthony?
Elizabeth Palmer in London. Thank you, Liz.